Welcome to another video, Health Tips 23. Um, we are still looking at, we want to continue looking at some complaints that the mothers may present to it in pregnancy. And we are looking at back pains. And they say back pain, sometimes it's due to the uterus, retroverted uterus, where it's sometimes tilt a little backward, or sometimes poor posture can cause it, and sometimes, or there might be a problem with the kidney, pyelonephritis, and that is something that is most times common in pregnancy, or there might be the onset of labor, because when labor starts, then there's the back pain. You have a little back pain. All right. Another one that is common is insomnia, where the mother will tell her that she's unable to sleep at nights and things like that. Sometimes, so we always encourage the mom to have like a warm bath last thing before going to bed, or some hot beverage. Yes, and ensure that the room is well ventilated, to enhance sleep. One thing I always tell my pregnant mothers is that if you are at home and you're unable to sleep, for instance, sometimes they tell her wake up wee hours of the morning and they cannot sleep, or sometimes they go to bed the time when they go to bed, they go to bed early, but they just cannot sleep. So what I always advise them to do is that it's either your television or your radio. So you're going to tune it on to like some soothing music, something soothing that you will enjoy, and you're there listening to it, and you're focusing on the music, and then you're there and listen to it until sooner or later the TV start listening to you. So that is one thing I always tell them, and for most times it works. Yeah, most time it works. So just ensure that you're in a good ventilated room. Take your warm bath before going to bed and drink something warm, and then you tune into something soothing on your television, your radio, your cell phone, or something like that, to enhance sleep. All right. One other complaint is like giddiness and dizziness, and with these we don't want to we don't want the mother to really ignore these, because sometimes it don't really have to be something serious that is happening, but we don't know, and we always try to we want always encourage our moms to be proactive. Don't wait until when it happen, when it gone, then you're going to rush to say, let me rush to go to the health facility. So with this, sometimes the mom can be anemic. All right, and if she's anemic, then she will experience this dizziness and this giddiness. Right. Um, like I say again, poor posture can cause it too, where the mom is lying down and get up suddenly, and then she can experience that if she does something like that. It can be um it could be, or it can be signs of ectopic pregnancy, ruptured ectopic. So where she's experiencing something like that. And with these, we always encourage them, check if you're experiencing anything like that. Check to see if any bleeding going on or anything like that. That because you want to make sure that is everything is okay with you and your baby. So, like I said, sometimes it might be something dangerous, sometimes it might not be, but we are not to take anything for granted. All right. You might have itching of the body where the mom complained that she's having itching. Sometimes poor personal hygiene can cause that. And like the vulval itching, it can be probably she's having an infection. Like the Trichomonas vaginalis is sometimes it is one thing that likes to present itself with this pregnant lady. Alright. The midwife would want to do a urine test to find out with this itching to see if the mom is diabetic, because being a diabetic, she can have that as well. Alright, with another one is leg cramps. And with the leg cramps, it can be like calcium, B deficiency, and things like those. So it's best for her if she's experiencing these problems, just to share it with the healthcare provider. They will know what is happening or do the necessary checks to see if whatever that, so that they can come up with a diagnosis to see exactly what is happening. Another thing that I want to talk about is preeclampsia. This is common to the primate, most time the primate gravida, most times. And what is preeclampsia? Preeclampsia is a condition where the blood pressure might be high. The blood pressure is high. The blood pressure is high. The person have swelling, sometimes the face, the fingers, the feet, especially the ankle. And if the urine is checked, a dipstick is done, then it can show protein in the urine, that she's spilling protein in her urine. So we said the headache from some either frontal headache but most time frontal. So you have headache, you have chest pain, you might have chest pain, not all the while you have chest pain, but headache, chest pain, edema, where the swelling of the different parts of the body, the face, the hand, the feet, and all of that, and the protein in the urine. So those are cardinal signs of preeclampsia. And preeclampsia means that the mom can go into seizure attack, because of the blood pressure. The blood pressure is high, so she can get seizures where she's going, what we call fits. So that is not something that you watch. And the other thing, you can be seeing, sometimes the mom complain of seeing mini, like she's seeing our blurry vision and something like that, like her head is spinning and something like those. So with those, that is not something to play around with, because when I tell you about hyperemesis, when I tell you about Preeclampsia is something that is dangerous. So if anything like those are experienced, then see your healthcare provider. Okay, all right. So that is it for the end of this part. Next video we'll be doing the vaginal infections and the different type of vaginal infections in pregnancy. Until bye.